Thanks so much for joining me on the Slice of Healthcare podcast. How are you today?
Great. How are you, Jared?
I'm doing well. Not too bad at all. I have a lot of, I'm from the Northeast, so a lot of family members have been complaining about the snow, and I just moved to Florida, so I'm enjoying the nice weather without the snow. So I'm excited.
Well, we're in Colorado. I'm here, and usually the winters are, kind of up and down. But we just got done. It's warming up today and tomorrow, but the last 3 days it's been not breaking single digits. It's been roughly like -4 to negative to 6 or 7 degrees.
So it's funny. I looked at moving to Colorado because every time I went there was like summer, and I'm like, this place is beautiful. And then someone goes, "You hate snow, though," and I'm like, "I do." They're like, "Then you don't want to move there." It's like, yeah. But I do actually. I think you're in a beautiful area. If I did winter sports, I'm sure I'd love it. But yeah. Anyway, well, I'm very excited to have you on the podcast today. I'd love for us just to dive right into things. If you could share with the audience a little bit about your background and how you got to where you are today, I'd be much appreciated.
Yeah, so I'll give the sort of short version of the long history. So I studied computer science, but then when I graduated college, I served in the Army for 5 years in Colorado, actually, at Fort Carson, Colorado Springs. And then when I got out of the Army, I served during Operation Iraqi Freedom 1, so the initial invasion. I got out of the Army, I went to business school, did that for a couple of years, and then I actually jumped into finance and was doing healthcare investment banking with Morgan Stanley, really focused on kind of healthcare M&A. And did that and really enjoyed some of the strategic work and getting and analyzing kind of companies at the at the kind of core financial level and understanding how they think about the industry. But I realized that was not the path for me. I wanted to, in the long run, start and run companies. So my first company was actually a healthcare service provider focused on radiation oncology, and it was a management service organization called Next Oncology. So I started that. I grew it. I ultimately sold it at about the 6-year point. And, we treated patients with brain tumor, lung cancer, prostate cancer. So as you can expect, of course, we took commercial insurance. Of course, we were a Medicare provider. And that really gave me my kind of first intro into the ground warfare that is healthcare. And I started a couple other companies as well, somewhat parallel with that. One was actually also a healthcare technology company focused on providing a solution for physicians and patients to better manage their medical imaging data. So you could think of it like Dropbox for CT and MRI. So instead of carrying those CDs around and using couriers to bring them from one physician to the other, we built a cloud-based product that the physicians paid for via SaaS kind of payment methodology, and then it was a free product for patients to be able to better manage their images. And so founded SonderMind originally in 2014 with my co-founder, Sean Boyd, who is himself a therapist, stemming from a couple of different points of view. One was my own experience in trying to engage in therapy. And I really was focused and determined to use my commercial insurance benefits. And that process was just ridiculously hard. This was kind of circa 2012, 2013, 2012, I think. And you should go on the insurance directory, you put in your zip code, you say, "I'm looking for a mental health provider," and here comes a list of names. And you call the first one because you don't know what they really focus on, and they don't answer. And you leave a message, and you call the next one, they don't answer. They never call you back, and maybe they do, but they're not taking clients anymore. And you call the third one, and she is taking clients, but she doesn't take insurance, and blah, 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 blah. And 3 months later, I finally found somebody who took insurance, who had availability, and then a month after that could actually go in and see the therapist. And that process was just horrible. But even beyond that, the care was good, but the consumer experience was really challenging. And so I thought there must be a better way to sort of solve this problem. And then the other side of the coin is my younger sister is a clinical therapist. She's a licensed professional counselor. And so I'd seen her journey from undergrad to master's to then working at an agency in a full-time setting to ultimately going into private practice, which was always her goal. And just all the struggles she had to deal with, ranging from how do I find clients to how do I collect, payment from them to how do I manage kind of the scheduling and things like that. She wasn't even going down the insurance path because she tried and they were saying no. And she said, I don't even want to touch that. It's complicated enough without doing that. So that was really the impetus, was seeing very much firsthand these kind of ways that behavioral health is so different than the rest of the healthcare ecosystem.
Yeah, I feel like behavioral health too was, you can make cases that telehealth was super useful for a variety of areas within healthcare, right? But behavioral health, especially, that model really made sense, and it's been booming especially over the last year. It seems like there's either a new company coming into the play, small focus, but yeah, I have a friend that was recently a guest on the podcast, Heard Mental Health, that he's focusing on creating the financial software for some of these companies as well. So the therapists, anything to make life easier, right? For the people that are providing the care and the patients. So that's interesting. What have been, I guess, some of the things that, as we've kind of stepped into 2021 after a crazy 2020, that you've been most looking forward to, that you're really excited about as we kick off the year?
Yeah, there's so much going on. We've grown tremendously over the last 3 or 4 years. We don't position ourselves, and we don't think of ourselves as a quote telehealth company. A year ago at this time, all of our therapists in all the markets in which we operate were treating SonderMind clients with in-person care. And so we literally 100% of our volume was not telehealth in February of 2020. In April of 2020, 92% of our volume was video. So our positioning is that it's actually not telehealth is just a modality, right? Like, we're doing this over Zoom. As a company, we've had almost all of our meetings over video because we're not coming into the office because of the pandemic. And if you were to say, would you prefer that, or would you prefer to at least have some level of in-person relationships with your coworkers and with your friends? I would say, yes, please. Give me back some in-person meetings. Give me back some, dinners together. Give me back some ways to engage. And that's for a professional relationship. When you're talking about a therapy relationship, a therapeutic relationship, that in-person connection is real. And so our goal is really to continue to offer high quality care via a hybrid approach. So therapists treat SonderMind clients over video, in person, using text therapy. All of this is on our platform. And we really try to say the best kind of way to get to the best care is to make sure that you have the right provider who can treat the issues that you're dealing with and you have a strong therapeutic alliance with. So over the last 12 months, we clearly have, expanded the technology suite pretty dramatically. We've also expanded our clinical focus. And so I think that's one of the areas that I'm really excited about for 2021. We implemented the ability to collect patient-reported outcome data in our platform. So things that measure clinical anxiety and depression, and feed that back to the therapist so that they can better adjust their care for their individual clients. And so we're doing a lot more of that. We're working on some initiatives with primary care practices and other partners regarding medical behavioral integration, and are really hoping to kind of continue to build out what we already started in 2020, which is a number of specialty programs that focus on different demographics or different issues. So when I say demographics, that could be, our program we have with the VA, for example, which has been really successful in the market that we're operating with them in Ohio. Another program that's kind of demographically focused is with first responders. So EMTs, firefighters, police officers, we have a special program for them. And part of those programs actually include training the therapist to be able to treat those demographics. And then from an issue standpoint, it could be things like postpartum depression. We're working on a program with a couple of organizations and nonprofits that focus on maternal mental health. And PTSD is another issue-focused thing. So we can make sure that somebody who's suffering from PTSD can get matched to a provider who is trained in dealing with that. So all of these are areas that are pretty exciting for us in 2021.
Thank you for sharing that too. It's really great to hear that February, you guys are not necessarily a whole different space, but like you were able to adapt very quickly. And I think that also goes back to what you were talking about. Like you're really focused on this, on helping the providers, on helping the patients. And at that time, right, and moving forward, that's what you had to do to adapt, and you did it. I think some companies made the mistake. They didn't do that, or they did it too late. It's nice to hear that you guys were definitely ahead of the curve and were ready to continue innovating. So thank you.
Yeah, it was all that team. I mean, we had such a huge effort. Things were, if you remember a year ago, beginning of March, it was crazy around the country. I mean, just, the pandemic COVID was really kind of starting to take hold, and then it just ramped really, really quickly. And our focus was absolutely exactly what you're saying. It was about, we have to, make sure that our clients can continue receiving care. First and foremost, we had thousands and thousands of people who are receiving care on a monthly basis. We can't just leave them in the dust. B, we had, at that point, hundreds of, close to thousands of therapists who rely on us as a primary means of their practice. And so, there were both sides of our marketplace needed us to do the right thing. And it took a monumental effort by the team, but they succeeded in such a strong way. It was really tremendous work in March.
Where can our audience learn more about, I guess, you and SonderMind?
Well, so SonderMind.com, SonderMind, is where you can find out about us. We are operating currently in 6 states, Colorado, Texas, Ohio, Missouri, Virginia, and Arizona. And one of the exciting things is this year we're going to be expanding to many new states across the country. We also are in network with all major insurance plans, so you can finally use your insurance benefits and get high quality mental health care. So that's the easiest way to find us. All of our social media links are also on our website, and then we're out there in the sphere of various mediums with regard to TV and web and things like that.
Perfect. And in the podcast notes, I'll include links to your social channels, the website, so people can learn more from there as well.
Great. I appreciate it.
Well, as you and I quickly discussed before the podcast, the goal is to have you and other members of your team on throughout the course of the year to cover different areas that relate to SonderMind. So thank you so much for joining me on this intro podcast to share information about yourself and the company. And we look forward to hopefully having you on again soon.
Thank you, Jared. It was great. A lot of fun.
Thanks.
All right. Bye-bye.